Jeff Singer, thank you for being with us.
Thank you for having me.
Jeff, you're a medical doctor, general surgeon in Phoenix, and you're a fellow with both the Cato Institute and the Goldwater Institute. And you wrote a chapter in the state health reform book entitled Empower Patients, Let Them Own and Control Their Prescriptions. Jeff, what's the point of your chapter, and how come patients can't already own and control their prescriptions?
Well, it's an unintended consequence of the advent of e-prescribing, which was intended to make everything convenient, is that before e-prescribing, a healthcare practitioner would give a patient a prescription, which they owned, and they could shop around to different pharmacies, for example, for better prices. But when it became e-prescribed, it was digitally sent into a designated pharmacy, and now the patient can't act as consumer because they don't have the prescription on them, and they've actually lost control over their own prescription, which is a part of the medical record that they own, and it's inhibited their ability to do comparison shopping.
So you talk about a federal rule that's important in this area to help give patients ownership over their prescriptions. Mention that federal rule.
Yeah, in 2020, HHS passed a rule that says effective 2022, patients can request from their medical providers, and their providers shall honor the request to transfer their medical records electronically to a smartphone app that meets privacy requirements. And then they will have the ability to carry their medical records around with them on their smartphone, and working through third parties can distribute their medical records, including the prescriptions, according to the way they see fit.
So Jeff, it really sounds like what states need to do is conform to this new federal rule. Can you just talk about that?
Yeah, basically, the states just don't have any procedures in place for this new federal rule. So they need to basically put into code that when a patient requests of their healthcare practitioner that their records be transferred electronically to a smartphone app operated by a third party, that they shall do it. In addition, states need to remove obstacles that right now don't allow pharmacies to transfer prescriptions between one another, so that if the patient decides that they want prescriptions transferred from one pharmacy to another because they can get a better price, they can do it more easily than they can now.
Hey, Jeff, thanks so much for your work on this chapter. It really does seem like one of the issues that should be low-hanging fruit for states, given high prescription drug prices, given that this is really about helping people in their state be better shoppers and have better control over their medicine.